Let's bring in Dr. Jaqueline Weyer from the National Institute for Communicable Diseases. Dr. Weyer, thank you so much for your time this afternoon. So the last time South Africa recorded positive cases of Mpox was in 2022, outside of these recent cases, when 5 cases were also confirmed in, I think, 4 provinces: Western Cape, KwaZulu-Natal, Limpopo, and Gauteng, with no cases reported in 2023. Perhaps let's start with just unpacking what the Mpox disease is specifically and the symptoms associated with it.
Yes, you are correct. We only recorded cases in 2022, no cases in 2023, and up to date 5 cases with the one fatality that the Minister reported this morning. So Mpox is a viral infection. It's associated with painful skin lesions, fever, swollen lymph nodes. These lesions are the most pronounced characteristic of the disease. If I have to describe the rash, it's a blistery rash, but the blisters will feel firm, even rubbery. If there's more than one lesion, they will seem similar in size and have a roundish shape. So Mpox is an uncommon disease. Only few cases reported in South Africa, and we're monitoring the situation for any further cases.
Now, according to the World Health Organization, and as you also rightfully say, a total of over 200,000 confirmed cases of Mpox in around about 117 countries. But just looking at the deaths, 186 deaths in those countries. How concerned then should we be, in South Africa, given that there has now been 1 confirmed death? I know you said that it is an uncommon disease, but also importantly, how do we protect ourselves?
Absolutely. So just to put into context, during the multi-country outbreak, those figures that you have referred to translates to a case fatality rate of 0.2%. So by far, most cases of Mpox present in mild self-limiting fashion. But you do see severe cases in individuals that are struggling with immunosuppression for whatever reason. This could be HIV, which is unmanaged. It could be other causes of immunosuppression. And in some countries where cases are also reported in children or in pregnant women, these individuals also have a higher risk of more severe Mpox disease. So the individual that passed away, that was diagnosed with Mpox, also had other comorbidities counting against him, and he also suffered from pneumonia while diagnosed with Mpox. So unfortunately, multiple pathologies involved in this particular case. So we do take Mpox seriously. This is not a disease that we usually find in the South African population, and measures can be taken to protect our population. We also know that we have a high prevalence of HIV and many cases that goes unmanaged. So it's those unmanaged HIV cases and other causes of immunosuppression that worries us. These individuals are at high risk for severe Mpox.
And you're just describing basically high risk in individuals. And of course, we've seen those provinces that were also hit back in 2022. I suppose what's important, just given that individuals with underlying illnesses are at high risk, when do they go to, the hospital? At what extent does this disease become even more dangerous, given, from the onset of the symptoms?
So if an individual is suffering from a rash which is unexplained, remember that there are many common causes of rash, allergic rashes, insect bites, other infectious diseases like chickenpox and so on. So if there's an unexplained rash or a rash that's causing worry, then we recommend that you seek medical advice. and then tests can be done to determine if Mpox disease is present. What's important is that severe Mpox can be treated with antiviral therapy. The earlier treatment commences, the better the outcome. So people living with comorbidities, people that are suffering from immunosuppression, if there's unexplained rash appearing, it is important to go to your doctor and seek a diagnosis.
Right, Dr. Weyer, thank you so much for that, and of course your time right here on the show. Dr. Jaqueline Weyer from the National Institute for Communicable Diseases there for us.